Okay, so the next part is actually addressing maybe some of your questions. So we're going to go through 3 cases of people who have issues with vision. And the first one is the patient that we saw earlier who have these features of Parkinson's disease and double vision. So I won't show you the video where, this is actually the video when he's talking about what happened. So essentially he says, when I'm driving, I see double. When I'm reading, it seems worse. So I'm going to show you a video of his eye movement, and feel free to describe it as you see it. So he's looking to his right and then left, right again, and then looking up, and then looking down. And now he's tracking this object. So the eye movement is sort of subtle. It's not very smooth. It's not a smooth tracking. It has a little jump to it. So right now he's been asked to look at that little white dot, and he's having a lot of trouble doing it. So he's able to follow, but he can't converge. So he can't look at this white dot that's in front of him. So this is called convergence insufficiency. So basically looking right, left, up and down pretty good, and then can't really cross the eyes. There are people who just don't do that very well, but this is a very common acquired issue later on with PD. Okay, so another way of precisely measuring what that difficulty is what's called an alternating cover-on-cover test. So it's actually not that fancy at all. Basically, we're going to take that black paddle and just cover each eye back and forth. And so when the right eye is covered, he's looking with his left eye, and then vice versa. When the left eye is covered, he's looking with his right. So the eyes need to cross in order to focus up close. So the first part you're going to see is he's looking at a distant target, and just notice how much his eye shifts or refixates when he's looking with either eye. And then the second part is when he's looking up close. So you're going to see that that shift gets bigger. So let me just play the video. So the eye comes in a little bit. And now the other eye comes in a little bit. So at distance, his eyes are not perfectly aligned either, but that's sort of a normal amount. So a little bit of shift with either eye. And now he's looking at a little dot that's right in front of him. So you see how much his eyes need to shift in order to focus up close. Hopefully everyone could see that in the back. So clinically, we can measure exactly what this shift is, and we could give prism glasses to compensate for that perfectly. So that would help people read by giving them prism glasses to overcome the convergence insufficiency. All right, so I'm going to go ahead.
Would a normal person make that shift in one step instead of several?
Yes, so very good. You've seen these videos before. So the saccades, the little movements, are smaller and slower in patients with PD. So sometimes they make several steps, even when it's a really small movement. Yeah, good pickup. Double vision in PD, this is probably the most common cause, which is convergence insufficiency. So all they need is a pair of special reading glasses. So not too bad. Double vision looks like this, meaning you see double. And when your eyes, so you have two eyes, so theoretically you could have two images, and usually the images are perfectly aligned, so you see stereo, so you see depth. When the two eyes are not perfectly lined up, you see two images. Some people think you see blurry. If the two images are very close, it just looks like it's a little blurry rather than double. And some people just don't even notice the second image, they just naturally ignore it. But essentially, if you have abnormal movement in one or both eyes because of the muscle, the nerve, the brain, then you see double. Okay, so I'm gonna go on to the next example. This is a woman who has eyes that can't stay still. So these are really common in PD, and they're more prominent with progression of disease. There's a fancy word for it. You know what? Can you see? We may have to dim the light again. So she has what's called square wave jerks, so her eyes are going back and forth. So hopefully everyone can see that the eyes are going left and right, and they're moving together. So the way the eye movements are controlled is you have these neurons that say go. They're called burst neurons. So the brain gives the signal, you know, I want to move my eyes to look at that ice cream bar. So then the signal goes green, the burst neurons fired up, and then the neurointegrators hold the eye in that position. So when the integrators are not working, you're not able to hold the eye still. That's how you get that back and forth movement. And so there are a lot of different areas in the brain that are important for holding your eye still. What I want you to remember is that vision is a very effective way of holding your eyes as still as possible, because you want to see as well as possible. And so you could literally calculate what you need to do in order to see as well as you can. So for example, you're on a windy mountain road and you're feeling sort of dizzy. You know, I won't explain why you feel that way. It partly has to do with your vestibular system. But if you look at the things around you, the stoplight, the tree, you could actually control that dizziness, that nausea a little bit. So by fixating, using your vision, you could overcome these undesirable eye movements a bit. And usually the patients who have these movements, they don't have any issues with their vision. They don't see that the world seems to be moving until it seems to be a bigger movement or more frequent. So you could have these abnormal eye movements and not be symptomatic. Okay, so any questions before the third case?
Is this kind of eye movement different than amblyopia?
Very different. So amblyopia has nothing to do with eye movement. Amblyopia has to do with the fact that you did not get proper visual feedback during development. So usually this happens if one eye isn't seeing very well when they were just born. So if the left eye, for example, had a cataract in it or something happened to the left eye and the eye wasn't properly trained, so the eye and the brain actually goes through a lot of training after you're born in order to see well, then that connection never get properly calibrated. And so you would never be able to see that well. It's always a little blurry in the eye, and that's amblyopia. So eye movement, I think the connection you're thinking is often these people have nystagmus. So they have these oscillating movements. So that's actually because the eye movement system did not get properly trained at the same time. So they often go hand in hand, but it's actually two different systems that didn't get properly trained. All right, so this is a patient who has progressive supranuclear palsy. So a little different from PD, but a lot of overlapping features. So I actually just want to play the video, and I'm not going to give you a whole lot of clues, and maybe someone in the audience or multiple people in the audience can give an idea of what is it that's causing this patient not to see well. So someone describe the eye movement. Maybe louder. Yes, some stutter in the movement, yeah. Yeah, so the smooth pursuit is not so smooth. But you know, he's capable of making those movements, so why is it he can't see? So now he's asked to look at that red dot on top. So he's trying to look at it. So why do you think he has trouble seeing? Actually, he's wide awake. But that's actually really good. Someone want to elaborate on that clue?
His eyelids are not moving.
Right, he can't keep his eyelids open.
Right.
So he basically came in saying his eyes were shut spontaneously. The bright sunlight sort of provoked him to keep his eyes closed. He can't have a conversation with somebody because they keep thinking he's asleep. And when his eyes are open, his vision seems pretty good. He also has difficulty focusing close up, so he also has convergence insufficiency. But eyelid is another big issue in PD. All right, any questions? In the back? Well, this patient is technically not Parkinson's. This is progressive supranuclear palsy, sort of a cousin of Parkinson's disease, but it can certainly happen in patients with Parkinson's disease. There's a question in the back.
Is the eyelid problem a mechanical problem in the eyelids?
Good question. So is the eyelid closure a mechanical thing, or is it volitional, meaning you're purposely closing it in order to concentrate? So all of these are possibilities, but the difference between you and him is he can't keep it open. So you be able to keep it open. And as we get older, there are lots of things that happen to the eyelid that's actually part of normal aging. So the folds of the eyelid just get sort of a little droopier for mechanical reasons. So that's different from PD, where there's either a forceful closure, or you just can't hold the eyes open. And you know, the person is wide awake and trying. So different reasons to have ptosis, but essentially for patients with Parkinson's, you could have sort of slightly more complicated issues. Question over there. Is there a treatment for this? The short answer is yes, but it depends on what the problem is. So if it's, let's say, blepharospasm, meaning there's forceful eyelid closure, we could do Botox injections to make the muscles more relaxed. If it's because of apraxia, meaning you can't, everything works, but you just can't keep the eyelid open, there are actually these special glasses that has little crutches in them that you could wear to help you open the eyes. I'm not kidding. And if it's because of droopiness from aging, then a simple blepharoplasty, you know, can lift it up. So it depends on the problem, but yes, there's treatment. This part is usually not too difficult to treat. All right, so teaching points, eye movement issues cause double vision. Convergence insufficiency is a common cause of difficulty with reading. The eyes and the retina issues, so I didn't talk about this specifically, but I want to just reiterate that the eyes and the retina issues can contribute to vision trouble, so make sure you get evaluated. Okay, so I'm going over a little bit, so I'm just going to mention something about driving. So PD affects about 1% of every, if you take all comers, those older than 65 years old, and 2% of those older than 85. So when you're out there driving, there are actually quite a lot of people that potentially could have trouble with vision. And driving, as you know, is very complex, involves physical and cognitive aspects and is continuously changing. So it's actually not easy to be able to drive well. The driving issues include difficulty recognizing traffic symbols, getting lost, seeing double, poor lighting condition, and you can't see well in poor lighting condition. Actually, I think the rest there aren't that many pictures. We could probably have the lights back on. And delay reaction time. The ways that people adapt, they drive slower, they drive less, avoid certain roads like highways, they don't drive at night or during peak traffic hours. However, they've done the study where they ask patients, well, how well do you think you drive? So everybody thinks they drive better than average. So when you estimate yourself, it's usually better than a driving instructor or somebody else estimate how well you're driving. So just make sure you get some objective measurements to make sure you stay safe. The main reasons people give up driving, number one is anxiety about being a hazard. And another is they find it's just difficult to concentrate and to do the task of driving. When you stop driving, there are lots of things that happen. Loss of independence, sometimes decrease in self-esteem because you have to rely on other people, and as a result, reduce activities. So this is the bottom line. The DMV says very clearly it's the driver's responsibility to report if there is any issue with vision and driving. The doctors are not mandated to report you. Obviously, you have to fulfill the basic driving criteria, which essentially is you have to see well in one eye. So double vision, for example, is not a reason the DMV could say you cannot drive. Because you have two decent eyes, you just cover one of them, and you could drive. Sometimes, I know it seems shocking, but so sometimes you could get a conditional license, meaning you're perfectly allowed to drive in the daytime, for example. Driving issues, eye and eyelid, this is just a review of what we talked about, eye movement issues, something has to do with the retina, delay in the information, decrease in spatial processing, sort of finding which row you're supposed to turn left, and slow cognitive function and responsive. So essentially, it's important to get evaluated because there may be a very simple treatment, a simple fix. All of these things should be looked at. It's not necessarily by one physician, but maybe a neurologist and an ophthalmologist, or maybe starting with an optometrist, just to make sure it's not something as simple as you just need glasses. And the teaching points for this section, driving difficulty is common in PD. You should consider being evaluated. Doctors are not mandated to report. Loss of driving is a significant issue for a lot of people, but safety first. So this is a summary of the 3 parts that we talked about. I'll just leave it up here, and I'd be happy to take more questions.
If a doctor is not mandated to report when he sees the patient, or they see the patient having a diminished vision.
Right. I mean,
But
they could
how
say you shouldn't drive,
Yeah,
but
and how many of them really tell the patient they shouldn't drive and they don't listen anyway?
so the question is, shouldn't the doctors be required to report this? So every state is a little bit different, but in the state of California, the doctors are not required.
Oh, it's California, it's not federal.
That's right. And in fact, the criteria for the fine prints, what the doctors need to fulfill in order for you to drive, that's slightly different from state to state also. But essentially, in general, it's more common that the doctors are not required to report it, but I usually tell my patients when they shouldn't drive because, they need to hear from someone. Question in the back? So Mirapex is not a contraindication for driving. And I know what you're talking about, sort of this excessive daytime sleepiness or sort of sudden issues. Those are relatively rare side effect that has been described, but in terms of vision and criteria for driving, that's not part of the law. But if you can't maintain eyes open, brain functioning, you shouldn't be driving. Yeah, I mean, I think everyone has sort of basic logic, that they need to follow. Any other questions? All right, thank you. You've been a great audience.